about the Living Life Fully project. And Judy, if you want to just share, I know you're going to share more about the actual project later in our session, but if you want to just tell us a little bit about why you chose this topic for this webinar today, and how the work of the After Now project is really relevant to the work that you're doing here in BC. And just a reminder to get started. It sounds like we're getting some feedback right now. That is probably, if someone hasn't already, you need to mute your speakers on your computer. Again, top toolbar, midway through the top toolbar, you'll see a speaker icon, and you want to hit the drop-down menu and mute your speakers. So Deirdre, can you share a little bit about Living Life Fully and how this webinar came to be? Again, you'll just want to hit *6 on the teleconference line.
Good morning, everyone. Thanks for joining our webinar this morning, and a very gracious and warm welcome to Dr. Phil Hanlon for joining us. My name is Deirdre, and I work with BC Healthy Communities. And as Stacy mentioned earlier, I've been working on a project in northern BC through the Public Health Agency of Canada aimed at using our integral capacity building framework to address healthy weights in youth in 2 northern BC communities, Prince George and the Upper Skeena. Actually, my colleague, Tam Lundy, first introduced me to the work of Dr. Phil Hanlon, and I thought this was a really fantastic opportunity that really paralleled with some of the work we were doing in northern BC in using the integral capacity building framework. And so I thought those strong linkages were really inspiring, and his call for the 5th wave of public health was really of interest to the work that we were doing up there as well, and so invited him to be part of this session today, and fortunately he was able to do so. So thanks very much.
Thanks so much, Deirdre. I think before we turn it over to Dr. Hanlon to hear more about the really interesting work that he's been doing, I know we've got a number of practitioners and folks who are doing really interesting work here in BC around the province, and I'd love to just get a sense of who's on the call. If you look up again at the top toolbar on the right-hand side, there's a little icon of a person raising their hand, and if you hit the drop-down menu, you'll see it gives you a few options. So, and the top one should say raise hand. So just to do a quick poll, looking at who's on the call, how many people are health practitioners? If you're a health practitioner, can you hit the raise hand icon? How many we get here? I see 4 so far. Looks like we've got 4 folks who identify as being health practitioners. How about policymakers? How many policymakers do we have on the call? And if you did have your hand up, to unraise your hand, you just click the icon again. You can lower it. It gives you an option. So for policymakers, looks like we have a handful as well. How about folks who do really on-the-ground community organizing and activism? If you identify yourself that way. Again, looks like a handful for, oh no, lots of people. Looks like you're wearing multiple hats. we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 who do on-the-ground community organizing and activism. And how many people are here just out of personal interest, not necessarily wearing a professional hat, but because this topic was a personal interest to you? Great. So again, looks like we've got about 4 or 5 people who say they're here out of personal interest. Fantastic. I know part of what we want to do today is learn as much as we can from Dr. Hanlon, and also we really want to create the space to have some dialogue and hear about your own experiences in the work that you're doing. And so again, I just want to remind everyone that at any point during the session, if you have any questions or comments or ideas you'd like to share, you can use the little rectangular box there. And I'll keep an eye on any questions that come up, and when there's a good time for us to open up the discussion, we'll review those. You can also use that little icon of raising your hand if you want to flag to me that you have a question or a comment that you'd like to contribute verbally. So without further ado, I'm going to hand it over to Dr. Phil Hanlon. Again, we're so thrilled to have you here today, and I'm so looking forward to learning more about the work that you're doing in Scotland. So again, to start, it's just *6 to unmute your line.
Hi there, it's Phil Hanlon speaking here, and thank you for your very kind welcome. And it's a pleasure to be in touch with British Columbia, not least because I have friends who have immigrated to Vancouver, and so we've visited on 3 or 4 occasions and feel we know that part of the world reasonably well. And we've enjoyed having both Bruce Alexander, who some of you may know for his work in addictions, and Tam Lundy across visiting us here in Glasgow, so that's been a treat for us as well. So what I'd like to do is share with you a little bit about this project, the After Now project, and you'll see there that there's a website, afternow.co.uk, so if there's anything that's said today that's of interest to you, then you can follow it up on the website. And we've recently published a book entitled The Future of Public Health. I'm not sure if it's available in Canada, but it's just to let you know that we're trying to get the message out in a variety of ways. The project is about some of the interactions between the culture of modernity and the health consequences of that culture as it plays out in countries like United Kingdom, parts of North America, and so on. And with apologies to Bill Clinton, whose aides famously said, it's the economy, stupid. I think that needs now to be modified. And as we face in the Western world such profound economic downturn problems, we need to see the links between the structure and the economy and the culture. And that's what I'd like just to explore a little bit with you. There's various ways in which we could do this, and one way is to tell stories. And I want just to very briefly, and we built these stories up as vignettes of 3 different people who are having their own struggles with the modern phenomenon of consumerism. And we imagined it like a Robert Altman film where their lives interact in the opening day of a new shopping mall, and they come to buy bicycles. And the reasons why they're buying bicycles tell of their history with consumerism. So here's Jean at the top right-hand corner. And Jean is a single mother who's, if you want to think about it in terms of chronic disease, suffers from anxiety and depression. But the truth of the matter is that symptomatology is a manifestation of stresses and strains in her life, above all financial stresses and strains. And she's a woman who's about to buy a bicycle for her son. Her son is 15 years old. He already has a wonderfully beautiful bicycle. He doesn't actually take it out and about. He meets with his friends and they have all the right cycling gear and they do tricks up and down steps in the middle of town. And he is determined, this 15-year-old son, that he's going to have a new bicycle because it's the latest thing and he needs the latest thing because he needs that credibility with his friends. And so what the son is showing is simply conspicuous consumption. And Jean is trapped in that circumstance. She's having to provide for him because she knows no other way of coping with this. And now we're very familiar with this approach, conspicuous consumption. But if we flip over to Andrew, he's a very different kettle of fish. He's a businessman, and in terms of the modern chronic diseases, he suffers from obesity and also from overuse of alcohol. But Andrew's fundamental problem is that he's lived a life of what would really be called exceptionalism. He considers himself different from other people, above other people. He uses other people rather than lives in relationship with them. And as a consequence, his relationship with his son has become very problematical. And he's lost contact with his son and feels estranged from him. And so what he's doing here, buying a bicycle, is playing a game with his own psychology, with his own psyche. He's going to buy a £2,000 bicycle, which is, he promises himself, going to be used for a cycling holiday that summer with his son. He's going to get fitter and go cycling with his son. In fact, the bicycle is destined to spend its entire life in his garage unused. But what he is doing is, and there's a big literature about this now, he's engaging in inconspicuous consumption. The purpose of his consumption is to make himself feel better about his life, not for him the display of consumption that Jean's son wants. Rather, he's using it as a way of soothing his own sense of loss and alienation. Jade you see in the bottom right-hand corner. And she's drawn from British culture. I don't know if you've got the equivalent here, but she's a defiant consumer. Jade has had a hard and difficult life, and she's never enjoyed good relationships with social workers or teachers or anybody in authority. And so she's got a defiant attitude towards them all. She has addiction problems with tobacco, with alcohol, and with drugs. She has a boy aged 4 called Darren, and she's currently pregnant. And the one thing in life she loves above all is her son Darren. But her life has been so subject to violence and to difficulty that she can't relate well to others who might give her a hand. And she's very afraid that the authorities are going to take her son Darren away from her. And in a desperate attempt to keep them off her back, she's in the shop today buying a small bicycle for Darren in the hope that he'll be able to become someone who's engaged in exercise, because he, you see, is already displaying signs of obesity and attention deficit disorder. Now, that's a rapid run through these vignettes, but I hope you'd get the picture that we're trying to paint here. And it is of the diseases of modernity, the problem conditions that we see in our healthcare system, but they have cultural underpinnings. In this case, I'm highlighting consumerism, but it's not the only thing that we might highlight. And we've been in our studies around many different aspects of Scottish life. So we've been all the way from prisons to the boardrooms of one of our largest companies and many points in between. And here's a quote. We have many of them, but this is an example of a quote from one of the prisoner group that we interviewed. And he says, people live in their own bubble, getting in their own car to drive to work, staying in their own home. Community spirit has gone, and this compounds the issue. We're all in debt. We're stressed. You go to work, you go home, you sit in front of the TV. There's no family dinner, no time to talk problems through, sort things out. You're just working to afford that TV. There's no time for your children when you come home at night, no time to talk. Now that, from a prisoner, speaking from his prison, of his experience outside of prison, was mirrored in so many different aspects of Scottish life that we encountered. Here's another from a health professional, in fact, saying our focus needs to go down to the spiritual, to the value and worth of a human being. Virtually nothing in society promotes that. We're exploitable because we are fearful. If you live in a society that's been founded on exploitation of the masses, how are you going to decondition them? How do you make people feel more confident in themselves? We're all trapped in the cycle of consumerism, and powerful groups can't be expected to support anything that will counter techniques for maintaining social dominance. And this is a very rapid run through some of the themes that we've been exploring in the After Now project. But you see, I hope, let me try and see if I can activate this pointer. You'll hopefully see this wave formation here. And what we did was we charted 4 previous waves of public health improvement. But once they've reached their peak, they then move into decline and are maintained as a trough. And that made us think that these diseases of modernity, these problems like obesity, loss of well-being, the rise in depression and anxiety, the rise in addictive behaviors, these problems, at least in Scotland, you might tell me different in Canada, but I suspect it isn't any different. These problems are not being solved by the approaches and methods that have been so successful to counter infection and some of the chronic diseases in the previous waves of public health intervention. And the reason for that is that we're trapped in this cycle of materialism, individualism, and consumerism. And these things are feeding upon themselves and giving rise to lives which aren't amenable to interventions that were successful in the past. This is compounded by modernity's belief in progress and the endless quest for economic growth, and our belief that growth can go on indefinitely. And all of that is associated with this phenomenon which in the literature is called economism. Economism is where the bottom line, the financial bottom line, becomes the dominant force in decision making. And so the crisis of modernity is not just a crisis of the disease that confronts our healthcare systems, but is compounded by the values that we've adopted and this desperate cycle of materialism, individualism, and consumerism. Now, that suggests to us that the whole project of modernity, which brought us so much, I'm not trying to disrespect modernity. I often say when I'm speaking about this that I have one thing to say in defense of modernity, and that is anesthetic dentistry. And it speaks of a kaleidoscope of factors that have made our lives better and will continue to do so. But there is a sense in which we've reached a peak and now seem to be moving into a financial and existential decline, or at least a crisis. And what that suggests to me is that we'll need to do something to outgrow the current crisis, to start a new wave of improvement. Not progress in the typical financial or the established financial sense, but one that speaks of a different form of future. And that's what we mean by a change of age. Now, is there any sign that for the sake of confronting our loss of well-being, our rise in depression, our epidemic of obesity, that we're about to change the dominant values of modern society? Well, almost none. Rather, we're showing signs of adaptation. We build bigger airline seats. The challenge and also the hope that convinces me that change is both inevitable and at one level to be welcomed is the sustainability crisis that we face. And in that context, I quote Chris Martinson's 3 E's. He speaks of the economy, which has seen an exponential rise in debt in the last decade, of the ecology, where global warming is the most tangible sign of an unsustainable exponential growth in carbon usage and carbon dioxide output, and of energy use, where peak oil, which I don't have time to go into any further here, but many of you will be aware of, the idea that our energy supplies that sustained modernity's growth have peaked and will go into decline. This lack of sustainability, and when we say that the modern world is unsustainable, that means it will come to an end. It doesn't mean that it will continue if we can only get some more oil out of shale or build some more wind turbines. So the fact that these 3 E's of the economy, of ecology, and energy are interacting to make our modern world genuinely unsustainable encourages me in the thought that we now have the possibility, because we will be forced to grow an interesting and new world which will build upon the best of what modernity has achieved, but move beyond some of the diseases of modernity and this spiral of move then to find this better future. And this is where I've borrowed Plato's idea of the true, the good, and the beautiful. And what Plato basically argued was that we as human beings naturally integrate the true, the good, and the beautiful. The true speaks to us of science. The good speaks to us of moral or ethical dimensions to life, and the beautiful speaks of the aesthetic. Now, let me illustrate how naturally we do this. Let's imagine that your partner comes home one evening and says, look, we're going to build an extension to the house. Now, in such a circumstance, such an idea would be examined from the perspective of the true. You would say, can we afford it? What would an architect think? Is there space? What about the structural engineering challenges? Now, we would, as human beings, naturally think along these lines, but these would not be the determining factors in terms of whether we progress. Because we are human, we would have an ethical discussion. We would say, is this the right thing to do? Is it the right priority for our family? Are there other things we should be spending our money on? Indeed, are we right, and is it proper for us to spend the money on ourselves? Now, the people I know would have that kind of conversation amongst themselves. But in fact, the clincher, the factor that would probably determine whether they go ahead with the project would be the beautiful. Will it be a beautiful thing? Will it open up creative possibilities in our lives? Will it be a space that the children can have friends round in or can do things in that they wouldn't otherwise be able to achieve? And so we very naturally integrate the true, the good, and the beautiful. But when it comes to public health, do we do the same? And I've asked this question, and I don't know whether it would be true of Canada, but I've asked the question that I want you to imagine that you're now on the board of your local health authority. I'm not sure what you call that administrative function in Canada or British Columbia, but we call it the local health authority here. Now, supposing they were planning the building of a new hospital extension, would there be architects' drawings, structural engineer reports, costing estimates? You bet there would be. There would be a pile of paper dealing with all of that. Then I've asked frequently of audiences, would there be an ethical discussion? And usually what's said at that point is there would be an option appraisal. It wouldn't be a truly ethical discussion, and it certainly wouldn't investigate radically different use of that resource. And then I say to them, now I want you to imagine that you raise your hand tentatively in this meeting and you say, and this new extension to the hospital, will it be beautiful? Will it fire our imagination? Will it raise our spirits? Will it heighten our consciousness? And at that point, they usually laugh. Because the idea of a modern bureaucracy being able to integrate the beautiful into that kind of decision-making is antithetical to their experience. And what that suggests to me is that we've failed to integrate. Indeed, we've largely elevated the true or science into an ideology, which is perhaps better called scientism, which along with economism means that we've a very narrow view of evidence and of the financial bottom line, which drives so much decision-making in our political and policy-making worlds today. And what that suggests to me is that if we've to outgrow the crisis of modernity, if we've indeed to succeed in creating a new age, then we need to learn a new form of integration. We need to integrate the true, the good, and the beautiful, both in terms of conventional and emerging ecological perspectives. So what we end up with is this simple model with 6 spheres: conventional and ecological science, conventional and ecological ethics, conventional and ecological aesthetics. And I want just to take a minute or two as we move towards the conclusion of what I want to say to explain how that might impact on our thinking. And I'll use 2 examples. One would be in the provision of health services, and the other would be in how we treat a challenge like food and healthy eating. So let's just take a little moment to work our way around the model as it applies to healthcare. So, in an integral or integrated future, would we have conventional science and proper evidence-based medicine? Well, absolutely. If I were to suffer from cancer, I would want the regime of chemotherapy or other interventions to have been subjected to rigorous randomized control trials. Of course I would, and so would everyone else. So there's no diminution or dilution of that traditional scientific perspective. But what I find is that it is very narrow in its application, and it hasn't taken into account new ideas in complexity theory and systems theory and an appreciation through evidence of how our actions with each individual impact more widely on the population, the community, the culture, and the whole healthcare system. And so I would argue, and I could go into more detail if any of it is wanted, and there's more detail on the website, that to conventional science we need to add a systems complexity ecological science if we're going to create a better future. With respect to conventional ethics, what are we good at in healthcare? Well, I think we're pretty good at trying to do good. Almost everyone I know who works in our healthcare system wants to do the best for their patients. However, we've become much less good at avoiding doing harm. And we've become very poor at promoting true autonomy. And we create a sense of dependence on an increasingly large proportion of our population. And particularly towards the end of life, at least in the United Kingdom, we're guilty of a level of intervention which isn't soft and appropriate and resonant with the kind of approach that really suits older people as they move into what is an inevitable diminution in their physiological function and towards death. And we almost need a new model of care for that. One of the things, for example, if we think now of ecological ethics that our healthcare system is incredibly guilty of, is throwing stuff away, wastage. We have a throwaway culture. Indeed, so afraid are we of prion disease that most of our surgical instruments are now use once and throw away. And we have an approach to the provision of food and other hotel services which is incredibly wasteful. And yet, we live in a world in which we need to contract our use of stuff, particularly of carbon, and converge across the nations into a more sustainable future. And I find that that approach to ethics isn't even discussed within our healthcare system. When it comes to conventional aesthetics, are our buildings beautiful? Do they have a healing dimension? Well, there are some lovely examples. And you probably have some too, but in general, our buildings are brutalizing and indeed not at all conducive to healing. But then if we go on and think about an aesthetic that would fire our imaginations, lift our spirits, what is the training program like? Is it something that raises consciousness, that has an approach that draws us close to our fellow human beings? Most people I speak to in our system don't find that that's what their experience of healthcare, either as an employer or as patients, that just doesn't work. But you could see, you could imagine, couldn't you, that if we integrated all 6 of these spheres, we could create something radically different and better. In conclusion, let's just consider food for a moment. Again, if I look at our public health advice, it's full of evidence-based pronouncements on what kind of eating is healthy and prevents disease. But there's so much more to be considered. We need to understand the impact of the whole food system on the human ecosystem and on our sense of well-being. And that's only beginning to impact on our policy-making process. We need to think about access to healthy food for all, and that's surely a global challenge. The issue of food security is hardly ever considered. But in an ecological, ethical perspective, we need to think about balancing health and cost. We need to think about sustainability of the global food system. And I find that in the United Kingdom, that global perspective just really isn't impacting on most people's thoughts. I hope it's different in Canada, but at the moment we have a big challenge to make that a reality. But of course, we don't eat food to simply maintain our biological bodies, and we're not just concerned with justice on a local or global scale. We basically eat food because we enjoy it, because it's part of the pleasure of living. It's part of how we interact with people, have friendship and fellowship and communion with them. And so there are emerging, I think, a variety of movements which would help move us in that direction. But linked to that would be the need to challenge our very mindset, our very relationship with food. And the integration of all of these, I find, is being taken up by some of the most forward-thinking and revolutionary of our projects. One example here is something called the Fife Diet Project, where people are trying to grow and live off food which is grown locally, not because we don't believe in a global perspective, but because that changes the relationship people have with food and what that leads to. So in summary, what we're arguing for here is a reintegration of the true, the good, and the beautiful to help create a new wave of public health intervention which builds on the best of the past, but also points to a future which has to address the challenges of equity, of sustainability, and of improved health. Thank you very much indeed.
Thank you so much, Dr. Hanlon. I love that expression, fire the imagination, and I feel like this presentation has done just that. It gives us much to think about. We're going to have some time to have questions and discussion with Dr. Hanlon. Again, I just want to remind everyone that if you have questions that have been sparked through his presentation or comments or ideas you'd like to share, you can type those into the chat feature on the webinar platform. You can also use the icon to raise your hand to signal to me if you have a question. But before we move to our discussion, I'm going to invite our colleague Deirdre with BC Healthy Communities just to share a little bit about the Living Life Fully project and how that work that's been going on here in BC links with some of the ideas that Dr. Hanlon has shared today. So Deirdre, I'll turn it over to you to share a bit about Living Life Fully, and then we'll open it up to a more full discussion with everyone.
Great, thanks, Stacey, and thanks very much, Dr. Hanlon. Just a quick review about the innovation strategy we've been working on in northern BC. We've been working in two communities, Prince George and the Upper Skeena, and we've been working in partnership, so it's a collaborative project with Northern Health, Canadian Cancer Society, Fraser Basin Council, Storytellers Foundation, the City of Prince George, and also AMG Consulting. In terms of the context of the two communities, there are two very different communities. Prince George has a population of approximately 77,000 people, the largest city in northern British Columbia, and about 21% of the population there is under 15 years of age. So this particular project working with young people is very pertinent to that community. And then the Upper Skeenas is the community you see on the left, also known as the Hazeltons. This community is very small, approximately 1,200 people, including the local bands nearby. And the economy in Hazelton is very depressed, but they also have a number of young people who are trying to create some change in their lives as well. And so what we did was we worked with these young people in looking at mapping the communities, having them design action projects, and then work toward policy development. In doing that, we asked them to consider the good, the true, and the beautiful, as Dr. Hanlon has described, and map out the assets of their community with those things in mind. And not surprisingly, that very process led them to look much more deeply at the issues related to healthy weights. So the map was something that we used to help us consider all of what was going on in the community. And because we're talking about young people, we recognized very quickly that many of them did not have control over the foods they ate or where they were, what restaurants they attended, what kind of food choices their families made. And so that was really insightful in terms of using the map as a guide. And we also recognized that one of the biggest things from their perspective was actually having a say in what was important to them in choosing an action project. And the action projects the teams decided on were very different for each of the teams. One of them focused on traditional foods, and the second project focused on offering a film festival locally. And the third focused on healthy living, healthy eating clubs within the schools. So all had a very different focus, but all looked at it from the perspective of what was important to the young people themselves, and also what was important to the context of the community. So looking at supporting all of me and all of we. Throughout the project, the young people used photo voice as one of the tools in the project. And they were asked to, in this case, we had a project team going out snapping some pictures. And this picture, I think, really defines the culture that we're up against. And so this is the first thing you see after walking into the local pharmacy in the community. And this is the sign you see. I think that's that way for a reason. And then these are some of the young people who actually worked through the Fraser Basin Council, and they developed a cookbook focusing on healthy traditional foods. And for many of them, it was the first time they were even exposed to what traditional foods were and how they were used. One of the things we used so that we could ensure that it was really a youth-led project was this ladder of participation. And we really tried to focus on having the young people in the project lead and initiate actions that were meaningful to them. And then, as I mentioned earlier, the third phase was to look at policy development, and that phase of the project is still ongoing, but we have had some influence in looking at food safety guidelines related to Aboriginal foods and traditional foods. And I think the benefit of the project has been able to have those young people really design the project from their perspective and look at the conditions overall for healthy weights for young people in the community. We'd love to hear from you about your experiences, and I'm sure you all have questions or thoughts about Dr. Hanlon's presentation, and so I'd like to turn it back to Stacy at this time.
Thanks so much, Deirdre. I've been so intrigued following this project, and from my perspective, it's been a very non-traditional approach to looking at the issue of healthy weights for youth. And I think it's a great example of putting into practice some of the pieces that Dr. Hanlon was talking about earlier, and taking a much more holistic and integrated approach to a very complex issue. So we're going to open up for discussion now. So if anyone has any questions or comments, this is the time to generate dialogue. And again, I really want to encourage folks to add your own ideas and share from your own experience. Of course, we want to make the most of our time with Dr. Hanlon and hear his thoughts, but it's also an opportunity for us to share about your own experiences on the ground. So to start off, we've got a question from one of the participants, so we'll open with that, and we've got some other questions that we'd like to guide the discussion. Reminder that you can just type into the chat box at any point if you have any questions or comments, or you can use the little hand icon to let me know you have a question, and I'll refer over to you. So there's a question here that says, how does all of this relate to the public health mantra, make the healthy choice the easy choice? Where does the beautiful choice come into the equation? So Dr. Hanlon, do you want to kick us off with your thoughts about that?
Hi there. By the way, do call me Phil. I should have said that right from the beginning, but it's nice of you to be formal, but it's not at all necessary. This is a good question about the healthy choices and the easy choices, and I think it is indeed a mantra. But I think that where the beautiful comes into it is as follows. If you look at so-called nudge theory or many of the theories of social marketing, you can get the impression that what people do in terms of making decisions is determined by things very close to them, very proximal to them, and often quite trivial things. And so if we can only manipulate that immediate environment, then people will make healthier choices. And that's often presented in terms of, for instance, food choices. Now, I don't disagree with any of that, and it makes perfect sense. And indeed, if you think about poverty as an issue, then if you can overcome some of the worst effects of poverty, then some of the healthier choices become easier choices. So I agree with all of that. But where I think it loses perspective, and where I think public health in using that mantra can sometimes fall into some of the assumptions of modernity, is why would people want to change? What would inspire them to change? What would be the change in mindset and worldview that would cause a change? And that's where the beautiful comes in. The beautiful is the dimension of life that inspires us, that changes our sense of what we want our lives to be about. And it's that I think will be necessary to confront these challenges of sustainability, and also to move beyond problems like obesity and loss of well-being. I don't know what it's like in Canada, but in Scotland, we're having almost no success in population-level obesity. There are great projects like the one we've just heard a bit about, and they're having an impact, and there are some individuals who are making change, but as a society, we grow more obese with each passing year. And the problem here, it would seem to me, is that we lack the consciousness and the imagination and the inspiration to think of and accommodate something better. So that's where I think the beautiful comes in.
Thank you so much. Others on the line, to throw in your comments, you just hit *6 to unmute your line. Does anyone else have any thoughts about this question of where the beautiful fits in? It's interesting because I think, I'm still sharing my own opinion, but that's not something we commonly associate in the sector of public health. Other sectors have been much more successful, I think, in integrating the aesthetic component, but that's something that's often left out.
Yes, I think the people in the mental health sphere have had to fall back on arts-based therapies and approaches like that, and have seen the importance of the immediate environment to people's immediate well-being. And so there are other disciplines that maybe have something to teach us here.
Yeah, absolutely. Any other comments?
It's Deirdre again. I just was thinking of how this showed up in the context of the project we've been working on. And I think really for the young people, they, for the first time, for many of them, felt inspired and thought that they saw themselves as change makers. So I really think that the links to the beautiful for them were about feeling like they had something to offer, something to bring to their communities to create that transformational change.
Well, it's interesting in that particular project how, when looking at the methods that you chose, Photo Voice and the Film Festival were two of the key activities, which obviously have a very aesthetic component. So interesting that those were the techniques that were chosen. So we have another question here for Phil. What programs are in place in Glasgow to break the cycle of the smoking, deep-fried Mars bar eating pregnant mom in the area, in an area with a very low life expectancy? Because I don't think she'll be thinking of the beautiful aspects of living. She's just trying to get through it.
That's entirely relevant, and it's a very good point. And Glasgow, as you comment, is famous for the deprivation that's occurred as the industrial heritage disappeared, and some communities have had now 3, even 4 generations of unemployment, and as you rightly say, people are just trying to get through. And so I don't want anything I say to trivialize the difficulty of the challenges people in these communities face. And I've worked now in public health in Glasgow for 20 years, and I could quote you scores of examples of programs that are designed to help with anti-poverty programs and public health interventions and so on and so forth. And some of them have had some success, but it's the overall lack of success of the conventional public health approaches which led me into this new work of the After Now project. And I think that unless we can imagine a radically different future, one that is sustainable, one that is more equitable, one that isn't constantly looking at the financial bottom line, one that isn't constantly trying to create economic growth in the conventional sense, one that doesn't allow consumerism to manipulate people's choices, and so on and so forth. Unless we can imagine that, I don't think we'll find a solution to the poorest areas in Glasgow. And so the challenge for our leaders, our political leaders, for our public health leaders, and for others, and indeed for activists working in the poorest areas, is to find a more integral approach, one that fires the imagination of those who are struggling as well as those who are less struggling and thus in perhaps more of a position to lead. And so I think there is a solidarity between those in the poorest parts of Glasgow, as well as those of us who work, as well as those who lead politically. And what I'm arguing for here is actually a quite fundamental change in our society, not a public health intervention. And it's a fundamental change in society which addresses the challenge of sustainability as much as it does of health, that addresses the warping effects of the culture of modernity that so distorts our lives. And why will we change? Because we have to. That's the argument I'm making.
Others, any comments around this question about people who basically are just trying to survive and get through? How do we integrate this piece of the beautiful? Deirdre, I don't know if you have anything you'd like to share specifically from the example of the Living Life Fully project. I know when you were starting out sharing some of the context of some of those communities, definitely looking at pretty high poverty rate in some of the contexts. So anything you'd like to share from your experience there? I just want to, we've got another question here before we move on to this question. I just wanted to double check because I noticed that Heidi had her hand raised, but I just wanted to make sure we got your question, Heidi. Great. So there's another question here. what would you say that the main challenges relating to getting systems to acknowledge the beautiful? How is this influenced? And is it a kind of outcome mapping project?
I think if we mean by systems, our big bureaucracies in our society, then I think they are the ones that are struggling most with this. As I tried to indicate in the presentation, I think individuals get this because it's just intrinsic to our humanity. I think small projects, a whole approach that we call social enterprise. I'm not sure that's like not-for-profit organizations, often with very motivated people. They do it. But if you go to the big bureaucracies, the healthcare system, the local authority, the police, and so on, they find it almost impossible to integrate the beautiful and indeed the true. They are captured by this perspective that the only thing that matters is the economic perspective and a very narrow sense of what counts for evidence. And my own view actually is that these large bureaucracies are, like much else in modernity, not sustainable. And it's not our job, or certainly not my job, to fight them. Rather, the best we can do is inspire them. And I think that there's nothing better than an example of something that works better on the ground. And so there are these small social enterprises, these innovative projects, and they speak of a different approach that can inspire and can help to change our big systems. But to be honest, I'm not persuaded that in their current approach and mindset that's going to be a radical change soon.
Well, I think that this links to one of the questions we have listed here on the screen. It's much of what we've been talking about throughout this discussion, but what would it mean to shift some energy and resources away from our focus on behavior change to a more comprehensive change that you're speaking about? And why is there often, especially in the public health context, why is there so much resistance to doing this?
I think there's often a resistance because public health is itself captured by this distorted emphasis on the true. So we've got trials that show the link between, say, diet and health outcomes, or smoking and health outcomes. And we focus on these things because that's what we can get money from the government to do and so on. But we know from our own introspection, we know from our own experience of life, and we know from for instance, I once had 300 health promoters in a room, and I got them all to tell their neighbor the one project that they've been involved in that most inspired them. And then we had this cascading process so that we got the 10 best examples shared with the rest of the room. And what emerged was that the projects that inspire us, ourselves as health promoters, are ones that people have been deeply engaged in. It's the human and humane presence of people working with other people, bringing out a healing resource within the lives of others that makes a difference. So even at the level of one-to-one interventions or group or community interventions, it's the quality of humanity that makes them successful. That was the unequivocal view of that group of people. But you won't find that view in any of our journals. Our journals are much more instrumental and biased towards the measurable. And I think that, in short, public health and health promotion are as distorted by scientism as is mainstream society, and that's why we find it so difficult to take this perspective. Now, the Health for All movement, the Healthy Cities movement, has attempted to get away from some of all of that, but it operates in a context where it's really difficult to move into a much more integral way of working, and it really is the individuals and the small projects that are succeeding, not the big systems.
Thank you. We've got a few more minutes for a couple of more quick questions before we need to wrap up. So I just wanted to open it up again to invite any other comments or questions if anyone would like to put them forward. Okay, we do have a couple of questions here relating back to the famous mom, famous smoking mom. So wondering, Phil, whether there might be green FICE food vouchers available to that mom, or Champix vouchers, or other highly relevant personal support?
The short answer is yes, and Scotland has a strong tradition of, and even within a UK context, we remain much more committed to the state supporting such a person. And, Jade would have been the recipient of much in the way of personal support through health and other professionals, and of financial and other support. But the reason why, and if I had time to expand her backstory as we concocted it, she's always felt criticized, and that's the reason for her defiance. She's always felt that teachers and social workers and health promoters and doctors blame her and criticize her, even though they are not doing so. Nonetheless, that's the way she perceives all of that. And that's why for her there is such a barrier between herself and those who would seek to help her in a conventional way. And that's why I use her as an example, because it seems to me that unless the values of our society, our professionals and our bureaucracies change, it will be very hard to break through to Jade and her circumstances. And Darren will be, unfortunately, fated to live out the consequences of being brought up in her orbit. And we see so much of that in the intergenerational problems of poverty and poor health. So what I'm not suggesting for a moment is that we abandon poor Jade to some kind of esoteric pursuit of the good, the true, and the beautiful. Quite the reverse. What I'm arguing is that by pursuing an integral approach to the good, the true, and the beautiful, we end up forming a relationship with her which might help in a way that programs thus far have not been able to do so.
Thank you so much. I'm aware there's a couple of more questions, but I'm afraid in the interest of time we're going to have to end there. I know people can probably contact you, Phil, through your website, I'm imagining.
That's correct, yeah.
I also just want to point out a couple of quick things before we wrap up our session this afternoon, that both presentations, Phil and Deirdre's presentations, are available here on the webinar platform in the bottom right-hand corner. You can download straight to your computer if you want to go ahead and do that there. Also on the BC Healthy Communities website, I believe it's listed under upcoming events or past events, we'll have all of the resources from today's session available. And in a few weeks, we'll also have a recording of the session available if any of your colleagues weren't able to attend today and want to listen in. You should see now up in the top corner a few links for some websites. The After Now project, the website has some really incredible videos. I believe there's 6 5-minute videos speaking to sort of the development of public health and where we're at now in modern society. There's also a link there for Living Life Fully, the film festival that one of the youth groups did, if you'd like to check out any of the films there. And there's also a link for a very short evaluation form. We'd love to get your feedback from today's session. We'll also send an email out to everyone, and really do appreciate your feedback to help us to learn from these sessions and improve them as we go forward. So again, I apologize that we don't have time for more questions, but I'd encourage people to be in touch with Phil or Deirdre after today's session via email. And I just want to extend a huge thank you to Phil Hamlin. We had quite a challenge getting the time zones straight, but I'm so glad it worked out that you were able to join us today. We appreciate your time and learning about all the work you've been doing. And
that's been my pleasure. Thank you.
Yeah, thank you. And Deirdre, thanks so much for sharing about the work you're doing here in BC and putting this into action on the ground. And thanks to everyone else for participating and your questions.